Welcome to this Informed Dental Consumer presentation. I'm Dr. Beth Dorian. The purpose of this presentation is to explain how it is that a tooth with recent dental work can suddenly and unexpectedly develop a full-blown toothache. If you recently had a crown or a filling placed on your tooth and now you've received the unwelcome news that you need a root canal on that tooth, you might be wondering why this happened. Fortunately, most of the time it does not happen. But when it happens to you, statistics don't matter. The answer to this question lies in the microbiological world of your tooth's pulp. While your pulp may not have been symptomatic prior to your dental work, we now know it was not healthy. It had a low-grade infection. I'll now explain how the low-grade infection likely developed in the first place and why it is that dental work can cause that infection to grow so quickly. While a healthy, intact tooth is tough for bacteria to penetrate, bacteria are pretty darn small. So occasionally they'll find their way into the pulp, even in the most structurally sound tooth. But that's no problem for a healthy pulp. It can easily fend off those few bacteria that make it in. But if the tooth accumulates defects over the years, like cavities, cracks, or leaky fillings, you know, the same defects that create the need for dental work in the first place, those defects can allow more bacteria to find their way into the pulp. Damaged teeth have lost some of the protective outer enamel layer, so they have exposed dentin. The dentin layer of the tooth is far, far more soft and porous than enamel. As the bacteria navigate through this porous dentin layer and invade the pulp in larger numbers, they're able to set up a low to moderate level infection. The trouble is, low to moderate pulp infections are often completely painless. As a result, unbeknownst to you or your dentist, the pulp could have already been infected before your new crown or filling was even started. Many of these pulp-dwelling bacteria can survive with little to no oxygen. These bacteria would like to have oxygen, but they can survive without it. When a tooth is reshaped for the filling or crown, it allows an influx of oxygen to these bacteria. They went from a merely surviving bacterial colony to a thriving bacterial colony. And as the infection grows, so does your pain. This process can happen fairly quickly, sometimes just days or weeks after the dental work. If your pulp does not start out with a low-grade infection prior to dental work, it won't develop a large pain-provoking infection shortly after the work is done. But in some cases, such an infection can develop many months or years after dental work. This sequence of events shows how this can happen, and keep in mind pulps can weaken and die for many reasons besides dental work. Despite these possible complications after dental work, most of the time they do not happen. Reasonably healthy pulps should withstand most routine dental work. However, sometimes when we have to place very deep fillings or we suspect that your pulp is not healthy, we'll warn you that there's a greater chance that you might develop a toothache later. If your pulp was not healthy to begin with, unbeknownst to you or your dentist, don't kick yourself for doing the dental work. It was absolutely necessary. Without it, you were risking losing the entire tooth rather than just the pulp. I hope you now understand why a painful toothache and the diagnosis of irreversible pulpitis can develop shortly after dental work in some cases and a long time after dental work in other cases. It all depends on what is happening in that hidden chamber inside the tooth, the pulp. Thank you for watching.